14 signs your liver needs help. What are signs and symptoms of liver problems? In this video, I'll discuss signs, symptoms, and 6 prevention steps. What are the best habits for liver health? What are the best foods for your liver? I'll give you a list of liver-friendly foods. It's crucial to know these signs to seek help quickly and prevent disease progression. But it's also important to know which foods to include in your diet. About 25 to 30% of people worldwide have liver issues. See how common liver diseases are. It's high, nearly 1 in 3 people. That's an extremely high frequency. What causes liver problems? Why are they becoming more common? One cause, likely what you thought, is alcohol. Excess alcohol can harm the liver, but that's not the main issue. The main issue is non-alcoholic fatty liver disease. Liver fat caused by processed foods, excess sugar, obesity, inactivity, and habits that harm your metabolic health. So it's crucial that you also control this issue of fat in the liver. There are other causes too, like pain medications such as excessive use of acetaminophen. Other causes like viruses, hepatitis A, B, C, and genetic diseases can also affect the liver, but the first 2 are the most common. It's important to know these signs and symptoms, as untreated, it can lead to liver scarring called fibrosis and progress to cirrhosis, where the liver tissue stops functioning. This can lead to a series of consequences. What are the functions of the liver? One of its main functions is filtering toxins from our blood. The liver also produces sugar or glucose, which is crucial during fasting periods. Ever wonder why you go to bed with normal blood sugar, but wake up with high levels? That's because the liver can produce sugar. It's vital for blood clotting and cholesterol production. Did you know the liver produces 70% of our cholesterol? Surprising, isn't it? Most think it's from diet, but it's actually from the liver. The liver also makes bile, which is essential for digestion. Did you know that? It handles all these functions. So what are the 14 signs and symptoms? Number 1 is pale stools, known as acolia. Stools become whitish because, as we've seen, the liver produces bile. When there's a liver problem, one of the signs is that stools become whiter or take on a pale whitish color. In medical terms, we call this acolia. You should also pay attention to your stool color. The second sign is yellowing, also known as jaundice. Why? When we have liver issues, our bilirubin can rise and accumulate in our skin and eye tissues, causing yellowing, making the skin appear more yellow. It usually starts in the eyes, the first place people notice. Even lower levels can cause this sign in the eyes. It then progresses and may spread to the body. Sign number 3, also strange, is itching due to increased bilirubin and other toxins. The liver filters toxins. If impaired, higher bilirubin levels can cause itching. From my experience working in emergency and inpatient care, I've seen many patients with liver issues. Itching is a key symptom, but many patients only mention it when asked directly, often thinking it's something else. They say, "I'm itchy, but I must have an allergy or ate something spoiled, or didn't sit well," when really you should check for liver issues, as it could be one of the signs. Sign number 4 is fatigue. Fatigue, why? Our liver is vital for our life, and one of the most common signs is fatigue. That extreme tiredness where you struggle to get up, find it hard to do physical activities, and also our liver is crucial for protein production. So a liver problem can lead to a condition called low albumin or hypoalbuminemia. I'm using several technical terms in this video, which I don't usually do, but it's important you understand. So as I'm speaking, I'm also explaining to make it clear, okay? So liver issues can cause fatigue. You need to check it out. It's often one of the first signs to appear. Number 5 is swelling. We've seen that liver issues can alter albumin and body proteins, causing swelling, mainly in the legs, but also elsewhere. Sure, swelling has other causes like heart or kidney problems, but liver issues are often overlooked. People usually investigate other causes, while the liver's role is ignored, even though it's causing the swelling. Number 6 is water belly, known as ascites. You've seen that legs can swell, right? Well, fluid can build up in other areas too. I want to highlight ascites, which is fluid accumulation in the belly area. It can occur elsewhere, but let's focus on the belly. It can also affect the lungs, called water in the lungs, or pleural effusion. Have you heard that term before? So liver problems can cause this as well. Sign number 7 is bruising or uncontrolled bleeding like nosebleeds. You notice wounds take longer to stop bleeding, as liver issues can affect clotting. They can alter platelet levels and other clotting factors. Another test, prothrombin time, is directly linked to our blood clotting. Remember I mentioned that one of the liver's functions was producing clotting factors? So, liver problems can cause these symptoms, like frequent bruises. Not the kind from bumping into a table, which you'd expect to turn purple. You know where that came from, right? This is different. You have multiple bruises but can't explain where they came from. Often these bruises are quite large, or you start having nosebleeds when you never did before. In these cases, liver problems should be investigated. And sign number 8 is the opposite extreme. Just as it can cause bleeding, liver changes can also increase your risk of thrombosis or blood clots, like deep vein thrombosis. Why is this situation particularly dangerous? These clots in deep veins can travel to the lungs, causing a serious condition called pulmonary embolism. Many people get tested, even for cancer, which also increases thrombosis risk. Many screen for cancer, but actually have a liver problem. Remember, I mentioned swelling and people checking kidneys and heart. Similarly, for thrombosis, other diseases are screened, but the liver is often overlooked. The liver plays a role in coagulation factors and the coagulation cascade, so it's crucial to evaluate liver function as well. With thrombosis, it's important to always try to determine a cause, okay? If you had deep vein thrombosis in your leg, try to understand why it happened. Were you immobilized, bedridden, or did you have surgery? Are there any changes? Were you taking any medication that could increase your risk of thrombosis? If there's no obvious cause, investigate other issues like liver problems. Sign number 9 is telangiectasias, also known as spider veins. I'll show a picture, as this can be due to hormonal issues like estrogen. Liver problems can affect estrogen levels, leading to an increase. In men, this change in testosterone-estrogen balance can even cause gynecomastia or breast enlargement. So if you notice these skin signs, you should also check for liver issues. Sign number 10 is pain in the right side of the abdomen. It's located in the right hypochondrium, just below the ribs on the right side. Got it? Why? The liver can sometimes cause pain. When inflamed, for example, it can be painful. Not just when touched, but many patients report pain in that area. This pain can also spread to the right shoulder. So many patients also experience right shoulder pain. Interesting, isn't it? You can see how many of these signs and symptoms are surprising. Who'd think right shoulder pain could signal liver problems? If you didn't know this, your like was well earned. Go ahead and like the video. We don't need 10,000 likes. In my recent videos, I haven't set goals. You guys end up asking for them. Please, I need to know the target. Many say this, so here it is. 10K likes to spread the video. If you're not subscribed, I invite you to follow along. Let's continue then. The 11th sign is drowsiness. As we saw, one function is filtering toxins from our blood. This can manifest as increased sleepiness. It could also mean hepatic encephalopathy, but that's a topic for another video. I'll focus on drowsiness here. Sign number 12 is dark urine. Just as it can lighten stools, it can darken urine. Now this is interesting. Many patients describe soda-colored urine. That's pretty intense, right? The urine really changes color. It's not just from not drinking for hours. Or when you do intense, strenuous exercise and sweat a lot, it can concentrate your urine a bit. That's not it. It's a change in color. It's darker urine called coluria. Sign number 13. I'll also show a photo of this one, which is xanthelasma. Do you see this change? This can be due to high cholesterol, liver problems. We know cholesterol is produced by the liver. So if you have liver issues, this production can get out of control. So liver function also needs to be evaluated. But here's the photo. It's easier to show an image here than explain these specific issues. Sign 14 of liver problems is reduced vision, especially at night. This happens partly because of poor vitamin A absorption, crucial for night vision, but liver issues can also decrease visual acuity. People usually notice it first at night, as you need better vision to move around in the dark. For example, if your night vision is worsening, you should also check for liver problems. So, how can we prevent this? There are 6 key steps to avoid liver problems. Alright, what are these 6 steps? We'll also cover food-related issues, so stay tuned till the end. The first step is vaccination. Did you know viral diseases can cause liver problems? That's why vaccinating against hepatitis A and B is crucial. Remember, hepatitis A is fecal oral. What does that mean? It's spread through the mouth, okay? It's not related to blood or anything like that, got it? So get vaccinated. How's vaccination in your area? Have you been vaccinated for these? I have. It's vital you do too to avoid such diseases. Step 2. Avoid ultra-processed or processed foods. Packaged foods like frozen burgers, pizzas, instant noodles, and processed meats. Always opt for the most natural diet possible. If you want a burger, you don't have to give it up. If you really like it, make it at home. It'll be healthier. Use lean meat and ingredients you know the source of, without preservatives. A diet high in ultra-processed foods has been linked to increased risk of fatty liver disease. As you've seen, fatty liver is now the main cause of liver problems in many countries. Got it? It's even surpassed alcohol, which is quite interesting. So avoid these foods. Try to peel more and unwrap less. Just following this advice alone will give you better health than most people. That's a pretty interesting tip, isn't it? So avoid these foods. You won't miss them, okay? Make your own alternatives, like the homemade burger I mentioned. Same goes for pizza. Opt for homemade ones. They're tastier and often cheaper. I know people often say, oh, but it's more expensive. Ultra-processed foods are cheaper, which is a big lie. If you buy ingredients and prepare meals yourself, or have someone who knows how, it'll be cheaper and much healthier. Tip number 3 is to avoid fructose syrup and corn syrup. These sweet syrups added to foods, you need to avoid them. Stay far away from these products. Check the labels. If it contains corn syrup or fructose syrup, I strongly advise against consuming it, okay? Number 4, also crucial, is to avoid restrictive diets and focus on healthy weight management. Why avoid restrictive diets? We know that a restrictive diet, if you suddenly lose a lot of weight, can worsen your liver health, even increasing the risk of necrosis, which is liver cell death. Did you know that? Lots of new information in this video. So what's really important for you to do? Make lifestyle changes and aim for controlled weight loss. The American Society set a specific number for this. It's vague to just say avoid losing too much or avoid restrictive diets. What's considered rapid weight loss that could harm your liver? More than 2 pounds or 1 kilo per week. Got it? Healthy weight loss is about 1 pound or half a kilo per week. This way you can achieve sustainable weight reduction. Avoid fad diets like only drinking this tea or only eating eggs. Such diets are hard to maintain and can cause rapid weight loss, causing a problem, worsening liver issues, and the chance of regaining all that weight even more is very high. Got it? So, you often ask, what's a good diet for the liver? The Mediterranean diet, for instance. It's a diet associated with protective factors for the liver. And number 5 is avoiding alcoholic drinks. You've seen that one of the main causes is alcohol consumption, right? So you need to avoid it, preferably zero alcohol, okay? There's a big debate on whether even one drink could harm the liver. We know if you have liver issues, like alcohol-induced fatty liver, it's best to have zero alcohol. If your liver's healthy, one drink a day hasn't been proven harmful scientifically. As an endocrinologist who understands metabolism, alcohol, and liver health, I strongly advise you to completely avoid alcohol, okay? However, if a specialist tells you one drink won't harm your liver, they're not entirely wrong if you have no existing issues. Step number 6 for liver care, which is crucial, is to include foods with anti-inflammatory properties. What are these foods? I've compiled a list to share with you. Well, garlic, grapes with skin, onions, broccoli, cucumber, and coffee. Studies show up to 3 cups of coffee daily can reduce liver fat, inflammation, and inflammatory markers. Isn't that interesting? Green tea, while less studied than coffee, is also known for its anti-inflammatory properties. Pepper, turmeric, ginger, guava, strawberry with anthocyanin, avocado with good fats all have anti-inflammatory properties. Another food I really like is dark chocolate. Cocoa also has anti-inflammatory properties. Remember the dose, up to 30 grams per day. Extra virgin olive oil can also help you. What's the recommended dose of olive oil? Up to 7 milliliters. Why do I suggest 7 milliliters? It's calorie dense, but this dose gives cardiovascular and metabolic benefits without excess calories. We've seen that you need to watch your weight too. Apples are excellent too because they're high in fiber. Eating seeds like pumpkin, chia, and flax can also help you and boost liver health. What score would you give this video? If it's 10, I'll make more videos like this. Now, tell me which part of the world you're watching from. I'm in Porto Alegre. Which video will you watch next? Here's a suggestion, a video where I talked about diabetes. Did you know diabetes can show signs at night? It's an interesting video. I'll leave a link for you to click and watch. There, I explain more about nighttime signs and symptoms of diabetes. I suggest you watch it. Take care. See you next time.